talking, can you share with us some of our conversations? Maybe the members would like to know on maybe we can do something a little bit different, a little bit out of the box, maybe get the ball rolling down the road? Or
Right.
are you going to get scoldings for that?
Not from you,
Okay,
I don't. Although I haven't been directly involved in many of the conversations, Chairman Choi has been talking with pharmacy because they have the details on how they work and what it takes to work. But the question that he has asked us to think about is how could the finances of the college be structured so that the College of Pharmacy building might be covered with revenue bonds that the college could pay from its tuition income. Tuition for pharmacy is on a par with the tuition for medical schools. It isn't exactly the same, but it's significantly greater than it is for undergraduate programs, and therefore the question is how to structure the expenditures from the college and in a way that would allow them to fund the building with revenue bonds.
Well, not only the building, but the entire college.
But the whole, yeah, right.
So what do you think?
So the request that's in the Regent's budget and in the governor's budget is on one end of the continuum. It's a traditional large amount of GEO bonds, revenue bonds that the college would pay at a rate under its current structure that would be reasonable. I think the proposal that you're asking us to think about is sort of at another end of the continuum where there are no GEO bonds and it's entirely from the revenue from the college. And as with most things, there may be a point in the middle where we have a really interesting approach to fund a college and fund a building that may be an interesting new way to think about it.
Okay. So are you for or against it?
I'm for discussing it further.
Okay.
So I'm an academic. I like new ideas, and also as an academic, I like kicking the tires and looking at details. And I think that we're in the process of a discussion that'll probably take a little longer to finalize.
Okay. So, members, if you have any questions, just you can interrupt me anytime, or else I'm just going to keep talking. So, if you don't get financing for the pharmacy school, is the pharmacy school on life support?
The accreditation is in jeopardy
So we have to do something by when?
this year.
We have to do something by this year. Okay. So, if you don't get any funding, are you going to stop the program? And if you do, what's the cost and what's the timetable for that?
Right. I don't think we've begun planning for not getting the building.
Okay. But you should, right, as a manager?
As a manager. There is a formal process under the accreditation rules about stopping admissions, teaching out. That would be a 3-year process, given that our students would have finished 1 year, they would have to be taught out. And that, of course, would have declining tuition income. And I should mention that the College of Pharmacy, unlike almost any other program in the system, is funded almost entirely on its tuition. Only 11% of its budget comes from general funds. And so as the tuition declines, the program would decline, but we would keep it on life support, as you say, until we taught out. We would prefer not to have to implement that plan.
How would you not hurt the kids?
By teaching them out.
Okay, what does that mean in English?
That means that if they're enrolled in the college at the time we are sanctioned, then we would be honor-bound to continue offering the courses and provide the instruction and the clinical opportunities until they finish their degrees.
So I guess it would behoove us to try every avenue possible to make sure that that doesn't happen and the pharmacy school does continue.
I would appreciate that, yes.
You know, there was an objection that the pharmacy school really belongs on Kaka'ako. What's your comments to that?
I wasn't here when the college was founded, but if you look at the Board of Regents minutes when it was, and the arguments that were presented, explicitly stated in there is the intention of the university to establish the college in a rural setting because of the need to develop rural healthcare expertise, and pharmacists provide that. Pharmacists are the only medical professionals that you can see without an appointment. And many people get frontline medical advice from their pharmacist, often about how to balance their medications, which is one of the leading reasons why people get admitted to the hospital. They didn't do the medications right. So when the board established the college, it was with a conscious intention to build the capacity for rural healthcare. And I believe you can learn how to serve rural health needs best in a rural setting.
So to the critics that say it should be in Kaka'ako, as far as synergies with the other medical educational facilities, you feel that that's not really important? Is that what you're kind of saying?
Well, in truth, the College of Pharmacy does have a location in Kaka'ako. They do have offices and classrooms in the Gold Bond Building. They do collaborate with the College of Medicine and the Cancer Center. In the current day and age, scientific research is not place-based, but is conducted broadly and often internationally. And education, as President Lasner indicated, is going more and more towards a distributed model. And we do currently have programs in Kaka'ako that take advantage of the synergies.
Duplicating anything?
No.
So you would still think that the best place for the pharmacy school at this particular juncture, because you started already, basically, right? You invested in infrastructure, you invested in programs and everything, is Kaka'ako. I'm not Kaka'ako about that.
Correct.
That's a Freudian slip. In Hilo.
Correct.
Okay.
It should remain in Hilo. And I believe that if it were to move its home location, there would be an involved process with the accreditors to do that.
Can you give us specifics about the accreditation, the timetable, when they're going to pull the trigger, what's the process? I'm not real familiar with that.
So the college was granted a preliminary status, not a technical term, in 2007.
Okay.
And when they admitted the first class of students, they got to another level. When they graduated the first set of students 3 years ago, they achieved, let me see if I can get the true technical term, candidate status, candidacy for accreditation. Full accreditation came with the graduation of the first class in May of 2011, but in 2013, since they revisit 2 years after granting accreditation, found the college met all of the requirements for accreditation except the one about facilities.
Okay. Did they specifically say that if you don't build a $50 million building, that you will not get accredited?
They weren't that specific.
Okay, so as far as the building is concerned, what did they say? If you stuck it in the new dormitories that you folks built, is that okay?
The rooms wouldn't quite be configured correctly.
Well, I understand, but I'm just making,
Right. The accreditors were looking for space that was appropriate to the function, that consolidated all of the activities of the college in one location. And currently we're located in, at one point it was 8 locations around Hilo. Being able to bring all of those together in one location was what the accreditors were looking for.
So if you moved in more portables around there, you'd be all in one location, and it wouldn't cost us $50 million. So,
Cost you pretty close.
well, I know you're paying for it, but it wouldn't
No,
be
but
as
I
much.
mean, the cost of the portables isn't significantly less than the cost of a building.
excuse me, the cost of portables is not more than $50 million building.
It's not a $50 million building.
And we're gonna get to that too. So basically, in this accreditation process, the accreditors have the right, I guess, to say that the state has to spend X amount of dollars on fiscal plan?
No, they don't say you have to spend X amount of dollars, but to be accredited, to retain the right to grant the degree, the facilities have to be appropriate to the function.
Okay, that's good. Members, any questions?
I have a question, Chair.
Okay.
How many students are attending the School of Pharmacy currently?
They're on the order of 360.
360. And how many students graduated last semester?
It's the classes are 90, and it's about 85 plus or minus each semester.
Oh, sure.
Yeah, could you take us through what the original plans for the building were and the cost,
Right,
and how we ended up at, what, 28 or
right.
today? I mean, maybe and what the building's going to look like.
Sure. So the way you design an academic building is you first ask the faculty what they'd like. And that's right. And then you bring in the architects and discover what they need. And when that was done, we had a building of about $66 million, 880,000 square feet, significant amount of laboratory space for research. That was clearly more than we could fund in a single building. And so we redesigned it to reduce the price to about $35 million by not completing all of the laboratories on 2 of the floors. In hindsight, that was a Swiss cheese model and rightly didn't generate a lot of confidence. And so now we have gone back to the architect and designed a 2-story building, not a 3-story building. One where all of the rooms are used for instruction and the work of the college. It is a simple building. It has a square roof. It is a building appropriate to its function as a place of instruction. And with that building, using the portables that we have, we should be able, I will say we will be able to consolidate the activities of the college in one location. And the portables will be separated from the new building we're proposing by a parking lot.
Does the current request include the amount of additional planning money and design money that you had to do to design the building?
No, we had some left over from the previous one. And the contract was still in place.
Thank you.
Okay, members, anything else? Well, there was a rumor. I didn't start this one. That you were going to rent space to pharmaceutical companies, and that was going to offset the cost. And what happened to that deal? And is that deal still on the table? And all that good stuff. Did you?
I was never aware of a plan like that.
Okay, there's no plan to build out so you can rent out space and
No,
offset
no.
cost.
The plan in the previous model that had empty space was to use donations to build the laboratories out. Again, in academic buildings, it's much easier to get private philanthropic contributions to fill something out than to put the skeleton of the building up.
If our financial model should work, would that be an ideal model for all professional schools?
That assumes I know more than I do. I'm not sure I'm
But
qualified.
you're a professor.
Which means I have an opinion on everything, right? Yeah. I think it's an interesting model. I think the extreme version of the model that you're thinking about is frankly how they run Harvard, where every tub is on its own bottom. Harvard has some benefits that the University of Hawaii doesn't have. It has a $32 billion endowment. But there are financial models for higher education that are the activity-based, budgeted, and what have you, and I think they're worth looking at.
Although I take credit for coming up with the idea, there are other institutions across the country that use this model successfully.
I'm aware of several who do use it, or something related to it.
Okay, so it's not totally a joy plan. It's something that's been used before.
I think it reflects a lot of your thinking, though. I wouldn't throw away the credit for putting it on the table.
I don't need the credit, because if you fail, I don't want the blame.
All right.
Okay, members, do you have any other questions as far as the University of Hawaii at Hilo is concerned? Yeah, go ahead.
Chancellor, can you refresh my memory? This journey has been, as mentioned earlier, 6 years. We had 3 graduating classes.
Right.
Why was it located in Hilo, the College of Pharmacy? Why not West Oahu? Or somewhere else in the system?
Right. As I mentioned earlier, the minutes from the Board of Regents meeting indicate that the university desired to place the College of Pharmacy in a location that would help develop expertise in rural healthcare, which pharmacists can provide.
I noticed that it is in the current budget, the College of Pharmacy, as it was last year. Maybe I'd like to ask the budget director.
Sure. You mean the budget director? The. Yeah. Remember, I didn't invite you, but you came. So there you are.
Good morning, chairs.
Thank you, Robert. How much of a priority is it with the administration at the College of Pharmacy?
In terms of CIP projects, I would probably classify the UH Hilo Pharmacy School as, if not the top priority CIP project, it's one of the most foremost CIP projects that's reflected in the administration's proposed budget.
Thank you. Thank you, Chair.